Hello! In this mental health video today, I would like to discuss something I have quite a bit of personal experience with. I see in the media and movies and whatnot that there's a stigma attached to it. That's a lot of it's untrue. So I was hoping to clear that up and kind of tell you my personal experience with this procedure, which is ECT, also known as electroconvulsive therapy. It's formally known as electroshock therapy, which I think really adds to the stigma as well. Yeah, it's been used, it's been known that seizures can cause changes in brain states. So someone who has been, chronically depressed or having other mental health issues, if they have a seizure, they've noticed that it greatly improves depression and brain states and whatnot. So humans have been doing this for a long time, since the Middle Ages. They would use a combination of herbs to cause seizures so that they could help people suffering with mental health issues. I learned about this aspect of it. I just want to let you know I'm pretty low tech, so I can kind of say my resources. I don't know how to kind of add them to the video, but Sherwin Newland, he did a great TED Talk on ECT, covering ECT, and that's really helpful. Another source is Electro Boy, who has had many of the ECT treatments and talks very openly about it, and he has a lot of really great information. He's a really smart guy. But anyhow, so yeah, and then they also they wanted to do this continuing into the 1900s, so they would use camphor, which is in mothballs. So if you can kind of imagine sucking on a mothball to like give yourself a seizure, so you can kind of increase the brain states. In the 1950s, it was used for the first time. 3 doctors took somebody off the street who was a known transient person and who couldn't even utter a sentence, and they performed electroshock or electroconvulsive therapy on him. But back then they did not have any of the muscle relaxers or pain, so it used to be a pretty barbaric treatment, especially for people who are elderly. They would have fractured collarbones and wrists and things like that. There was a lot of moving around. Today, after the 1970s, and we have our muscle relaxers and other great things. ECT is a really painless, very quick, and super easy procedure, actually. It's not to be taken lightly. It is for just the most severe cases of mental health issues. But yeah, so I was in need. I was almost catatonic, basically, back in 2010. After I had my daughter, I got really, really depressed, and I got with a really terrible psychiatrist in Washington, D.C. that just loaded me up with all kinds of unnecessary treatments, medications, antipsychotics, antidepressants, benzos, like all these things that I absolutely did not need. I just needed some support being a new mom. Anyhow, I just kind of allowed this. I agreed to take all these pills, and it made me catatonic. There was no life in my eyes. I would just kind of sit around. I was really, really, really cognitively impaired. I tried working a restaurant job, which is something at that time I had done for 15 years, and I couldn't figure it out. I couldn't hold a tray. I couldn't ring in an order. I couldn't do anything. I was so just hopped up on these antipsychotics. So it was decided to try something new. I had a consultation with a ECT doctor who works really closely with my psychiatrist, which makes total sense. But he was actually a really wonderful, gentle, loving doctor. He's wonderful, Dr. Stephen A. Polikoff. So I went ahead and had the procedures. You can have procedures usually 8 to 10 or 8 to 12 within a 2-week period, and that's the typical amount of time it takes people to start seeing results from the treatments. I personally didn't see any results at all, and they kept going with more and more treatments. They wanted to, it was just in one hemisphere. And that's what they do. They put a high frequency electrode on your brain and then concentrate energy when you are safely sleeping. There is something in your mouth just to have you, the oxygen and all the medicines and whatnot get to you, but you don't experience having something in your mouth because you are asleep. The last 5 minutes, there's a few seizures, 1 to 3, and they're up to 30 seconds, and then that's all, and they bring you back. Because of muscle relaxers, there's not a whole lot of like jilting and like movement and all of this that you see in the movies. That's fake. Back in the 50s, yes, before all the extra medication, but none of that. The most that will happen to you as movement wise in an ECT treatment is the fingers will curl and shake a little, and same with the toes, and perhaps a little bit more breathing on the stomach will be up and down, but that's it. You come back in recovery, and you're good. Basically, you go home and you get lots of sleep, and your family hopefully takes care of you. Like I said, I wasn't responding to the treatments at all at first, so they wanted to go unilaterally, which I'm glad, because the next treatment I started getting results from it. And so I'm really grateful that they only did that to one hemisphere, because it all costs something, and it's the short-term memory that's definitely gone. And I knew that going into the procedures and things. I just didn't care. I was so comatose and whatnot, but it's still a life-saving procedure. I will say it is incredibly doctor-friendly, incredibly hospital-friendly. Therefore, it could be likely that it would be abused. I know that ECT is only offered in situations where there is no other hope. Like me, I had tried every medication, every therapy, everything, and that was the last-ditch effort. It's very much, that's what it needs to remain. It's an $8,000 to $9,000 procedure. It's 5 minutes, and the hospital gets half of that, $4,500 for this facility fee. So you can imagine that, it could kind of be, it would be really, really beneficial. In a lot of hospitals, you wouldn't know, but many hospitals offer ECT, and they will, like, even if you have just mild whatever, I don't know, I feel like they really not push it, but they offer it a lot, which kind of concerns me because it costs so much of your brain. It really does. Yes, I'm alive and I'm vibrant and I'm off all these terrible meds that, I was on before, but I definitely have memory impairment. Yes, definitely wanted to, when I came back to and I started remembering my body and remembering myself and getting in touch with my intuition after the treatments and stuff like that, the first thing I was like, I have to get the hell away from big pharma. I have to get away from these psychiatrists that have done nothing in my mind but only hurt me, and get off all these crappy medications. I'm still definitely being medicated, as I will always for the rest of my life, for psychiatric, but it's very minimalistic now, and it works with me instead of throwing a bunch of Seroquel, Trazodone, Prozac, all the benzos, all these things. It's a lot better, so I'm really glad I have that, but I also know that I wouldn't get to the point of being catatonic and needing electroconvulsive therapy if it weren't for my doctor every time I was there writing a different prescription, writing extra prescriptions over and over and over. And it definitely was my decision to take those, but because I had a doctor and I believed that my doctor knew how to help me and I would do anything my doctor said. So unfortunately, you have to really think for yourself and not just blindly trust healthcare professionals ever. Perhaps I was naive in that, and I know that some professionals, like the one in DC, like he just didn't have any integrity and didn't care to make people well. So you really have to pick and choose, and I'm not saying that all of them are bad. I'm just saying I left psychiatry and I'm a much happier person because of it. I go through a naturopathic doctor. Naturopathic doctors go to med school and then they have all the nutrition expertise and a lot of the stuff that for my mental health is really helped with having that, nutritional aspect. My naturopathic doctor has like 20 years of psychiatric experience as well. So she was more than happy to take me on as a patient. I know that a lot of naturopathic doctors will not take you on as a bipolar patient, well, they can treat you as just a person who has bipolar disorder, but to do med management and treat things like that, they don't feel comfortable taking on a client with bipolar disorder. So I'm really lucky in my area. I live in Seattle that I have access to that. But yeah, please think about whatever you do to your body, whether it's a tattoo or a haircut or whatever you want. Just please make sure that everything is okay. I had only bad side effect that I had from the ECT other than memory loss, which is incredibly prevalent. I have a lot of short-term memory loss. Basically, I have no short-term memory. It's really tough to learn new information. I can, but it takes just so much more repetition. So I'm learning to study a lot. But yeah, the only other issue I had was when I was coming out of recovery. One of the nurses was, normally it's always been very quiet and very professional, and after getting done with the procedure, but one particular time a nurse was in the recovery room and she was talking to somebody else about her personal life. She had my husband, my kids, my job, my car, like all these stressful things that she was saying, just normal talking, and it imprinted on me for a year and a half. I had nightmares about that for a year and a half. So if you're going to get ECT, I would just say, or your loved one is, probably if you're going to get ECT, you're not watching this video and making decisions like this for yourself, because it is a last-ditch effort. But if you have someone who you care for who is going in, just have them think about all of these things. Yeah, thank you so much for watching this. I hope it helps somebody. I know that I don't have a ton of formal education on this, but I am very knowledgeable and experienced, life experience on it. And it's not a barbaric procedure. It's not horrible like in the movies. It's not, but it is deadly serious that you don't want it to happen, like, unless it's absolutely necessary. I can't stress that enough. But there shouldn't be a stigma about it, because it does save lives. It's really awesome how it works. They still don't know how it works. It's still completely elusive how this thing happens in our brain, which is pretty crazy. But yeah, I'm glad I had access to it. I hope it helps. Thank you.